Okay, if I could just have your name and title for record.
Sure, it's Peter McAllister. I'm Director of Clinical Research and the Headache Center at Associated Neurologists of Southern Connecticut.
Now, unfortunately, millions of Americans suffer from chronic migraine. How is chronic migraine defined?
So chronic migraine is defined as 15 or more headache days per month lasting more than 4 hours each, and at least half of them have to have migraine symptoms. So that begs the question, what is migraine itself? And we're talking about not just a mild headache, but a moderate to often severe headache with light and sound sensitivity, nausea or vomiting, and really this leads to disability. That is, it pulls you away from the things you need to do. Kids miss school days, adults often miss work, taking care of the family becomes a burden. And there are 36 million Americans who have migraine, and about 3.2 million Americans are estimated to suffer from this worst of the worst condition, the 15 or more headache days per month or chronic migraine.
And when we talk about these chronic migraines, how exactly does this affect the quality of life, the everyday activities and abilities that most of us could take for granted?
Right. Well, if you could imagine, 18, 20, 25 days a month, you are lying in a bed in a dark room with the shades pulled down. You've got someone else taking care of the kids. You've called in sick yet again to work, or if you manage to drag yourself to work, you're showed up, but you're really not able to function at your best. This leads to increased rates of depression and anxiety in sufferers of chronic migraine. It increases healthcare utilization. These people are going to emergency departments, etc., and it really leads to a marked decrease in the quality of one's life. The important thing is about 80% of those who have the diagnosis of chronic migraine don't even know they have it. They're trying to treat it themselves, and they're suffering through. And one of the points to get across really is that there are treatment options for chronic migraine, and if you are having many days a month of chronic headaches, you need to seek out a neurologist or a healthcare specialist.
Now, are there any known causes or reasons for why so many people are suffering from these migraines?
We know that migraine is a genetic brain disorder. So there's often a family history of others suffering from migraines. Women get migraines 3 times more than men do, so being female. There are a number of other risk factors, and then there are lifestyle choices that can increase the number of headaches per month. For example, lack of sleep, hormonal cycles, the wrong foods, not drinking enough water, lack of exercise. There are many things that can take you from having few migraines per month to many migraines per month. So in addition to the treatment for chronic migraine, which I'm sure we'll get to, one of the things we work on here at the Headache Center is changing lifestyle, getting more sleep, exercising, eating the right foods, having a good outlook on life, stress reduction, and that can lead to a decreased number of headache days.
Now, one of the problems that we deal with is not getting diagnosed or not getting accurately diagnosed. How many Americans have not received an accurate diagnosis?
Well, of that 3.2 million, we're looking at over 2 million who are probably not diagnosed properly. They're either diagnosed as just migraine, not chronic migraine, or they're not even diagnosed as as migraine at all. Some folks have a stuffy nose component to their migraine and are misdiagnosed as having sinus headache and are treated with antibiotics and steroids and things like that. So they're getting not only no treatment, they're getting the wrong treatment. So making an accurate diagnosis is the first step towards selecting the proper treatment to try to drive this condition down. And while we don't have a cure for migraine or chronic migraine, we have the ability to impact these patients' lives significantly if we make the diagnosis and give them the proper treatment.
You mentioned treatment. What are the treatment options that are available?
So there are many different treatments available for migraine, the infrequent or episodic migraine. For chronic migraine, the 15 or more headache days per month, there's only one FDA-approved drug, and that came out in October 2010, and that's Botox.
And if people are wanting more information or wanting to know if Botox is right for them, where do they need to go?
Well, there's a great website I can direct your listeners to. It's called BotoxChronicMigraine.com. And there's a whole lot of information on that website on migraine and chronic migraine and the use of Botox to treat chronic migraine. And they can even enter their zip code and find a healthcare provider who is interested or an expert in chronic migraine to help them out.
And what are some treatment centers, or what is a good treatment center in the state of North Carolina where people can go to get relief that are suffering from chronic migraines?
Well, fortunately, North Carolinians have pretty sophisticated health care in their state, as I'm sure you know. One center that I've worked with, and it's probably one of the leading ones in the country, is the Carolina Headache Institute, which is in Chapel Hill. They do research, they treat patients, they have a foundation. It's a really wonderful organization.
All right. And did you have anything else that you wanted to add?
Well, just that the idea of suffering in silence needs to change, that this is a condition that costs a lot in terms of quality of life and healthcare dollars, and treated properly, these patients can live a whole lot better with the proper diagnosis.
He is Dr. Peter McAllister. Thank you so much for your time.
Brandon, thank you.
All right, that is a wrap. I do greatly appreciate it, Dr. McAllister.
My pleasure. Thanks for having me.
Yeah, take care.
Bye-bye.
Bye-bye.